In today's modern world, the spine problems is not just the issue of older people. Right now, people in 20s, 30s, 40s had major problems with their spine. But this has changed dramatically over the last decades. This age limit has dropped more and more. In my daily practice, I work with people in their 20s and 30s, and many of them already have severe spine and nerve problems. This is no coincidence. This is the result of how we live today. We move less, we sit too much, we exercise very little, and we eat low-quality food. We sleep poorly and we live under constant stress. When all these factors combine, the results very predictable. The spine starts to break down earlier than you should, and in today's video I'm going to give you everything that you need to know about how to use perfect vitamins for your spine, in my opinion, how I helped thousands of people over the years in my praxis. The real problem, what happens inside the spine? In the most cases of unhealthy spine, the real problem is not the bone. The real problem is the nerves. Nerves exist the spine under every level. When the spine is under constant pressure, those nerves become irritated and inflamed. This can happen in the neck, the upper back, or the lower back. Wherever it happens, the symptoms are very similar. People feel burning, tingling, electric sensation, weakness in their arms or legs, and the pain travels down the body. And very often, this is caused by disc problems, bulging disc, protrusions, and disc herniation. And disc presses on the nerve becomes inflamed, and pain becomes chronic. At this stage, most people focus only on the pain relief, but pain is not disease. Pain is the only signal. And my core specialty when I work with the patients is going to be spine problems. For the almost 30 years, I cure many people that have those spine problems, and the main always thing is going to be your nerve damage. In the most cases, it's going to be problems with nerve inflammation in the back of your spine, but it can happen all over the body. Nerve inflammation of nerve problem is going to be problem number one. Problem number two is going to be, of course, arthritic changes in your spine. The most important vitamins for unhealthy spine. If you have nerve-related back pain, there is one group of nutrients that matter more than all. These are B vitamins, especially B1, B6, and the B12. Those vitamins are not optional. They are essential building blocks of the nervous system. And every nerve in your body is covered with protective layer, and this layer allows the nerve to send signals properly and without the pain. B vitamins are required to build and maintain this protective layer. Without them, nerve healing is slowed down. In the short, this means if you have nerve problems, you really need B vitamins in pure organic form each day. If you don't have them, if you have chronic disease in your spine, maybe for a couple of months, couple of years, you are already in a lot of problem, because I'm almost certain that you have B vitamins deficiency problems. Vitamin B1 supports energy production inside nerve cells. It helps nerves function instead of shutting down. Vitamin B6 and B12 are crucial for the nerve protection and regeneration. They help maintain the nerve coating that prevents constant irritation. Those vitamins also affect the brain. And your spinal cord is directly connected to your brain. From the brain, signals travel down to your spinal cord, and from there nerves exit the spine and reach the entire body. And B vitamins are essential for the stress regulation. The vitamin help the body produce calming brain chemicals like serotonin and dopamine. When those vitamins are low, people often experience more stress, more anxiety, more depression, and constant fatigue. And this is unbelievably important, because in many people that already have those chronic problems with your spine are developing those problems with stress, depression, and anxiety. And this is the main thing that you really need B vitamins each day. How to take B vitamins for unhealthy spine? Now let's talk about something very important. How you take B vitamins matters as much as the vitamins you take. Many people take them incorrectly, wrong dose, wrong form, wrong timing, and they say B vitamins don't help. And also one thing that you really need to remember, B vitamins is not a quick fix. It's the perfect fix for you, but it's going to help you on the long run. You really need to stop believing in those quick fixes with chemical medications or whatever. They don't exist. What really is going to help you is going to be the healthy way of living, healthy natural remedies, and especially those B vitamins. Which B vitamins matter the most? For nerve-related spine problems, 3 B vitamins are essential. Vitamin B1 on thiamine, vitamin B6 pyridoxine, vitamin B12 cobalamin. These 3 work together. Taking only one is usually not enough. Recommended daily doses are vitamin B1 50 to 100 milligrams per day, vitamin B6 10 to 25 milligrams per day, vitamin B12 500 to 100 micrograms per day. Those doses are commonly used for the nerve support, and they are well tolerated by most people. More is not better, consistency is. Which form is the most important? Vitamin B1 works best as benzothiamine. Vitamin B6 should be taken as pyridoxine or P5P in moderate doses, and vitamin B12 should be methylcobalamin form. Avoid cheap combination with unclear forms for matters because nerve needs active vitamins, not inactive one. And in my experience, 99% of those supplements that you buy, it's really garbage and cannot help you in 100 years, because we live in the world that everyone lying to you, and you think right now you will go to your local pharmacy or whatever you're going to find those B vitamins is going to be perfect for you. Unfortunately, that is not the case. When and how to take them? Always take B vitamins with food, not on empty stomach. Best time is in the morning or early afternoon, and they support nerve energy and mental focus. Take them late at night can disturb sleep in sensitive people. And drink enough water. Hydration matters for the nerve function. And this is exactly what you need to know about supplements that you need to take if you want to have healthy spines that contains good quality organic B vitamins form. But as always, I'm always going to recommend you, in perfect world, we are eating perfect food, right? But unfortunately, that is not the case in the modern world, but nevertheless, I'm going to give you perfect food that contains all those B vitamins in the pure form. If your diet is poor, vitamins will only help partially. Here's a food rich in B vitamins. You really need to eat to support your nerves: beef liver, chicken liver, eggs, sardines, salmons, tuna, grass-fed beef, turkey, chicken, lentils, black beans, oats, brown rice, buckwheat, spinach, broccoli, avocado, sunflower seeds, and the walnuts. Regular intake of those foods create long-term nerve resilience. Please remember this list. Write it somewhere. If you have nerve problems, this is really going to help you a lot. Also, in today's video, I'm going to explain you why you never get better, especially if you rely only on chemical medication each day. Now we need to talk about something uncomfortable but very important. Modern medicine is very good at reducing pain, but reducing pain is not the same as healing. When someone has spine pain, nerve irritation or disc problems, the most commonly prescribed medication fall into few groups. First is going to be painkillers and anti-inflammatory drugs. Those are medications like NSAID. They reduce inflammation temporarily. They reduce pain signals going to the brain, but they do not repair nerves, they do not rebuild discs, and they do not improve circulation. Second one is going to be muscle relaxant. Another common group of muscle relaxant. Their drugs reduce muscle tensions around the spine. They can make you feel looser for the short time, but the muscle tightens for a reason. Very often, they trigger to protect irritated nerves. When you relax muscle without fixing the nerve problems, the instability remains. That's why the pain often comes back, and soon as medications stop. Third one is going to be cortisone injection, are often seen as a strong solution. And yes, they can reduce inflammation fast, but cortisol does not heal the tissue. It suppresses inflammation. And repeat injection can weaken connective tissue. They can reduce tissue quality over time and much more. And here is the key point. Spine problems rely only on the chemical that are mechanical and nutritional. In the short, what this means, if chemical medication works, I've been giving chemical medication to my patient every day. But I never use them because I learned a long time ago, if you rely only on chemical medication, you will get worse and worse and worse over time. Unfortunately, you people don't understand this, and you rely on the chemical medication, and that's why the number one reason why people disable in the modern world, especially people after 50 years and older, is going to be spine problems. Why people get stuck on the medication? Because pain disappears temporarily. People stop moving, they stop exercising, and they delay rehabilitation. Months pass, muscle weakness further, and nerves stay irritated. Then pain returns stronger, and this is not failure of the patients, this is limitation of approach. And I'm gonna give you a couple more information and what is also very important. And when you rely on those medication each month, each year you're gonna be a lot worse. And trust me, my dear viewers, this is last part of the video. I see it in the thousands of people all around the world for all my career. There's a lot better way how you can get fixed and you get healthy with your spine. Not rely on chemical medication. They don't fix the core reason why you have back problems. And if you have any kind of chronic spine problems, you have any kind of chronic disease, it doesn't matter which country of the world you are right now, you can call my office here in Croatia. And I will give you information how I can help you to get better and healthy with your spine problems. I repeat once more time. I work with the patient all around the world directly with phone consultations or in my office. This is especially important with phone consultations. Call my office, Viber, WhatsApp, it doesn't matter. I'm going to give you explanation how you can get better. This is only important for everyone who has chronic problems with your spine. This means over 3 months, maybe a couple of years, I really can help you. Second very important information is going to be for everyone who wants to take unbelievably good quality organic minerals and vitamins directly for your spine. You also can call my office. Contact us when we give you exactly what we use in our practice. Pure, organic, perfect, natural vitamins and minerals that really can help you. That's why I urge you, call my office, whatever reason you need, and I will give you everything. I believe I really can help you because this is my core specialty. My dear viewers, thank you for following me. God bless you. God bless your family. See you in the next video. Bye-bye. My name is Mario. I am European medical professional with over 26 years clinical experience working with the patient all around the world. My core expertise include nutrition, natural medicine, physical therapy, and rehabilitation. Through my MarioLab natural healing programs, I have helped thousands of people every year improve their health, regain mobility, reduce chronic pain and chronic diseases, and restore the quality of life. And those programs may help you as well. If you would like to visit my clinic in person, or if you prefer my personal phone consultations without traveling, my team and I are here to help you. Contact us via Viber or the WhatsApp at the phone number +385 98 9179 200. Your health deserves serious, professional, and individual approach. Thank you for following me. See you next time.